What's up, everybody? Welcome to MoveU's specialized program for excessive curve in the low back. You might call it anterior tilt, lordosis, hyperextension. Now, there's symptoms associated with that, which you're probably attached to that label right now. SI joint pain, spinal stenosis, facet joint pain, degenerative joint disease, or spondylolisthesis. These are all labels attached to the underlying cause.
I'm tired of being labeled.
We ain't working those labels anymore. We are going to be addressing the root of this issue. Now, if you have felt a deep ache in your low back, especially when you walk, or sharp pain when you're standing, or maybe you step off the curb incorrectly, or nerve pain that goes down your leg whenever you stand, you are in the right place. Now, and if you've looked for answers, you've probably been handed a few random stretches and exercises, cat cows, bird dogs, this stuff. Chiropractic adjustments, which can be a fantastic tool to relieve pain short term and increase mobility. Pills, shots, the promise of surgery that never addresses the root cause. That's because they're all treating the symptoms and not the real problem. This program is for you if, number one, pain worsens when you stand, tightness in the back, sharp pain, shooting pain, sciatica pains when you walk, when you stand, when you jump, when you land, and when you go down steps. You feel that deep pain, achy pain, shooting pain in the dimples of the low back, that's your SI joint. Your posture shows signs of too much curve in the back, and too much curve in the low back, in the upper back, or you notice you've got a big shift forward with the hips. Even uneven hips have to do with it. If you have joint pain, SI joint pain on the right side, facet pain on the left side, that's a sign of uneven hips, which we're going to be addressing in this too. This affects both men and women, but more common with women because women carry more anterior tilt naturally than men do. And pregnancy is going to further amplify that. And when the baby comes out, it's not like the muscles pull back in there again. So more common with women than men, but definitely affects both. If that sounds like you are in the right place. To make sure, we have a downloadable qualification guide below. Make sure you can answer the questions on that just to give you some confirmation you're in the right place. So your spine is designed to distribute pressure evenly. Your discs in the front and the joints in the back, they should share the load 50-50. But after years of sitting incorrectly, maybe you missed a developmental period where you never developed your core properly, poor posture, your spine is shifted into this hyperextended position. And here's what it means. It means that your facet joints are under constant compression. Every time you move, your vertebrae jam together, especially if you step down a step wrong or off a curb. Now, that's enough to even send a shock wave through the body by stepping off the curb incorrectly. Over time, your body tries to fix this by growing more bone. And what doctors label that as is degenerative joint disease. It's not a degenerative joint disease. It is a result of you living like this. You see, your body creates more bone where there's pressure. And so if you have arthritis on the joints, it tells you that you had too much pressure on the joints for a period of time, over a decade, and your body's making new bone. And what can happen is that bone growth starts at the joint, but it can grow into the canal where the nerve is in the back. And that nerve, it can jam up that canal, and it can cause that what's called stenosis, which is pain that goes down the leg whenever you stand or walk usually. So it's years of poor alignment and movement that are just finally catching up with you. So this didn't happen overnight. Your body has adapted to years of misalignment. Sitting too much, it weakens your core, shifts your pelvis forward, forces your spine too much arch. This causes then poor glute, poor core activation, and leads to excessive pressure on the joints. Structural changes. You may have had car accidents, sports injuries. There is some genetical factors in play.
That means he has bad genes.
Pregnancy. These can all be the start or the acceleration or the amplification of this process that led you to here. And remember, most treatments fail because they focus on the pain, not how you move. So if you follow the traditional medical route, this is where they're going to take you. Painkillers, opioids, anti-inflammatories, which are temporary relief, but your joints are still grinding. Radiofrequency ablation, they just go, hey, what if we just turn the check engine light by cutting the wire, which is essentially what they're doing to the nerve. It does nothing to stop the compression. If anything, it allows you to continue moving like crap and not getting the feedback that your body's trying to tell you. Surgery, ultimately what they do is they decompress your spine and they put screws and plates in your back to hold you in a position because you never figured out how to do it yourself. And that surgery is absolutely gnarly. There is carnage behind these surgeries. The risks are so downplayed. It is a brutal surgery. There's very little room for upside and a significant room to become worse after it. Again, your spine isn't the problem. Your movement is. And until you fix that, the pain is going to keep coming back. What this program offers is science and clinical backed solutions. Reducing joint compression through targeted movement relieves pain and inflammation. Strengthening your glutes, transverse abdominis, scapula stabilizers, and foot muscles corrects the misalignment to offload the pressure from your joints and better distribute them throughout your muscles and throughout the disc. In turn, long-term joint pressure relief slows, and in some cases, you can even reverse the degeneration. This program is backed by over 30 peer-reviewed studies and is tested with thousands and thousands of members online and clinically tested myself with patients. So this isn't just about pain relief, it's about training your body to move correctly for life. So at MoveU, we believe in 4 pillars to a pain-free life. Alignment. If your joints aren't in the right position, you're moving like crap. Movement. Strengthening and reprogramming movement patterns so the pain stops for good. Recovery. Mobility work, self-massage, and activation, not resting. You can rest when you sleep. Mindset. No one's coming to fix you. That's what fix your shit is. It's your body. Take control, take ownership for it. I've outlined the whole path for you below on how to do that. This program is designed for those who take responsibility for their bodies. If you do the work, your body will adapt and it's going to heal. It works every time. These are the laws. This is science. These are the laws of biomechanics. This program doesn't just give you exercises. It reprograms how your body moves. You're going to be going through 3 structured phases. Phase 1, alignment and control. That's the first 90 days. You're going to be retraining your spine and pelvis to sit, move, and stand in a neutral position. Phase 2, strength and stability. You're going to now be strengthening the muscles that hold you in good alignment so you can hold them in position for longer and longer and become more aware of it. Phase 3, real world application. Apply everything to daily life, sports, and training. The more time you spend in neutral alignment, the more your joints heal. Healing takes time. Aligning yourself takes very little time. And it's the frustrating part with the body. It's that I wish you could heal faster. And there are ways to increase the speed at which it heals. We can get into that later. I wrote about that in the ebook as well. But the longer your spine is in the proper position, the more your body's able to do its innate thing, which is self-healing. It will heal itself if you keep it in alignment long enough for it to do so. A lot of people want to know, is the program safe? Look, the first week is breathing. If your doctor is giving you clearance to breathe air, it's safe for you. The movements in MoveU are more controlled, more gradual than daily activities like walking or bending or even crawling on the ground. And this progresses you step by step with small incremental progress. You're not going to be going from pelvic tilts to overhead squats, all right? It's step by step, ensuring there's no unnecessary strain. So if you can follow simple instructions and commit to 15 minutes a day, the program is going to work exceptionally well for you. Exceptionally well. The final words are this. Number 1, listen, you have to move slow. You guys move too fast. It's like giving a 16-year-old keys for a Ferrari. Like this thing's gonna end up in the top of a tree. Rushing is gonna reinforce your bad habits. You have to move slow. Contract the muscle, squeeze it, feel it, hold it, breathe into it, reverse it. It is that slow. You are reprogramming yourself.
This will feel a little weird.
And you're not gonna do it through sets and reps and trying to knock it out like you're trying to put 100 pounds on your bench press.
Try to relax.
Just commit to the process. Guys, don't try to skip, don't try to shortcut. I've literally spent thousands of hours, me and the team, to put out the most perfect order for you to train and to learn. It's all in there and it's in order. So the healing takes time, but it happens with consistency. Last, stay engaged. Look, you've got a community feature, use it. Tap the community button, ask your question there, post your movements in there. We have coaches and experts in there that are going to help you. Jump on the lives. I'm on the lives. I'm in the community. Like, you have to stay engaged. If you're engaged, you're gonna be connected. If you're gonna try to do it all alone on your island, the chances go down that you're gonna be able to do it. So you've taken the first step, right? You're here. Now it's time to fix your shit. Like, let's go to work.